Okay, so here we have a 65-year-old female postmenopausal with no history of smoking, drinking, or breast cancer. She's a mother of three, and she felt a non-mobile lump in her left breast. From mammography and ultrasound, we found a 3 centimeter mass with smaller satellite lesions. And from core biopsies, we found ductal invasive ductal carcinoma. But from MRI scan, we also found a mass in the liver. As hence tissues were removed from her breast and her liver and was sent for further investigation at the histopathology lab for diagnosis and report. So here in figure one is a breast tissue biopsy with invasive ductal carcinoma stained with H&E, and is a primary site of where the tumor developed. The tumor later metastasized to the liver. There's evidence of desmoplasia, so forming fibrotic tissues. The fibrotic tissues, the fibrosis were the light pink stained in between the tumor stained cells stained in dark pink or purple. So little light pink tissues in between the elastic, well, they look elastics, yeah, tissues. And then here in figure two, we have primary breast carcinoma. It's composed of atypical epithelial cells with uniform nuclei, and there's lack of normal gland structure. So the structures don't look normal. Figure three, we have, well, invasive ductal carcinoma is usually palpable as it is stated in the case study, and that the fact it is, invasive carcinoma can be confirmed by the lack of myoepithelial tissue in the section because of the breach in the myoepithelial cells and the surrounding tissues. There is a malignant ductal proliferation because of the number of high mitotic index in the ducts. There is proliferation of neoplastic cells in the tissue originated from the ducts in this case. The cells infiltrate outside the normal breast lobules and ducts, which is also known as the infiltration of the lymphatics, to grow into the breast connective tissue. It potentially spread into other organs, including the liver, in form of metastasis. Here is a metastatic liver tissue stained in H&E again. Liver is most common sites to which malignancy metastasizes from breast in adults. Metastasis to liver carcinomas is relatively common and frequently encountered in clinical settings. Again, a liver biopsy is histopathologically examined to confirm the suspected metastatic lesions. Secondary liver cancer usually develop in non-cirrhotic liver parenchyma. Because the liver receives a dual blood supply, which is systematic and portal, the liver is one of the most common hematogenous metastatic sites, as it's formed from invasive ductal carcinoma via lymphatics invading through malignant cells, which are again obvious due to the high number of mitotic cells displayed on this section in figure 4. The presence of liver tumor can be confirmed due to presence of disrupted hepatocytes and liver lobules appearance on the section. We have figure 5, which shows desmoplastic growth proliferation on the liver tissue. So high number of fibrosis. Figure 6 also shows an evidence of replacement growth patterns. So the tumor infiltrates through the breast tissue without disrupting the normal architecture.